Good morning. This is Andy Reese with DDS. Sorry that we were a bit delayed getting started today. We had some challenges between the conference line and our login. We have about 60 people with us today. I'll just briefly, as people are aware, our data is now shared on the mayor's website, and what it shows as of yesterday is that there were 145 people who had tested positive, with 20 deaths and 22 people who have recovered. Just to also give a little more context, we currently have 19 people who are in the hospital, 32 people who were in the hospital and successfully discharged, and there are 74 people who have been diagnosed with COVID, but have not required hospitalization. Some have been asymptomatic, others have been receiving care at home. And among our provider staff, we have 143 staff who have tested positive. We are working with providers to get clarity about the period of time that is, so that we can be clear about how many staff are impacted at a given period of time in terms of their ability to work related to COVID. And unfortunately, among the provider community, we have had 3 deaths. So we have just a few questions this week.
Good morning. Can we go visit the places that are opening up, like Ocean City, Maryland?
So in the district, we still have a stay-at-home order. And so people really should be limiting their travel out of their homes to essential activities. And driving to the Maryland shore, I don't think qualifies as essential. Getting out in your neighborhood and getting exercise certainly would. I recognize this is really challenging, and as time goes on, people need to be, it's like decisions that you'll be making, and we are right now, the mayor is working on a plan for reopening DC, and we're considering all these decisions about how do you open things back up in a safe way. And those are the kinds of things that each of us are going to have to think about as we move forward. Because as the conditions allow, and those conditions would have to be that we see 2 weeks of declining cases in DC, then we can start to venture out more. But for a very long time, we are all going to have to be conscious of ensuring that we're taking all the steps necessary to protect ourselves and other people, which, as a reminder, includes frequently washing your hands with soap and water, doing everything you can not to touch your face, certainly making sure that to the extent you have to scratch your face if there's an itch, that you wash your hands first and then do it, and that you keep a distance from people of at least 6 feet. That would be if you hold your arms out and they hold their arms out, that your fingers don't touch, so that you stay a good distance away from each other. And if you go to public places, that you put on a face covering, because what we're learning is that there are many people who contract this and don't know that they have it. And that could be you or me. And so we need to make sure that when we go out in public, in the event we are one of those people who got it and does not feel sick at all, that we're not passing it on to other people. And so that same thing would go about going out to the beach over the weekend. It's going to be really cold this weekend. It's really not a beach weekend anyway. But going out to the beach, you'd get close to people. And people may feel fine, but that doesn't mean that they are fine. So like I say, it's going to be a long time of us adjusting to a different way of life. And we need to be thinking about how we do that.
Can you get tested without having symptoms? Do you need a doctor's note for tests?
So I get confused about dates because my days are very long now. So I think it was the week before last that there was a change made in the recommendations from the city, from the DC Health Department regarding testing. And so a person now who is considered to be at high risk, which would be a person over 65 or with some underlying health issues like respiratory issues, breathing issues, asthma, heart issues, high blood pressure, diabetes. So these kinds of, if someone is at higher risk for having serious complications from COVID, and they have had a contact with someone, then they can be tested. There are some public sites where people can get tested, and one of those is right across the street from the Metro at, from the Fort Totten Metro. And these sites require an appointment. I'm going to, while I'm talking here, since we don't have a lot of questions, so people can go to coronavirus.dc.gov and get information about testing, which I will tell you about right now. There are a number of public sites that you can go to. When you go to a public site, you don't need to have a doctor's note in order to get tested. But you do need to call in advance. And let me just tell you that some of the information you will see on the website in terms of testing is that you can expect to wait between 45 and 75 minutes. So if you're going to go get public testing, make sure you're prepared to wait. They don't have public restrooms. Make sure you go prepared to wait. The Bertie Backus campus of UDC, which is right across from, it's on South Dakota Avenue. For people that go to Project Actions, very close to that. They have testing Tuesdays and Thursdays. It's drive-up testing. And you need to call these places for an appointment. And the telephone number for Bertie Backus testing is 443-997-9537. Howard University has just started doing testing in Ward 7, and you can call 202-865-2119. And as I said, on the coronavirus.dc.gov website, there's a lot more information about testing.
Can you repeat that phone number, please?
The Howard University number is 202-865-2119. I do want to add one more thing, because as people have talked about getting tested, someone who has been in these meetings with me over the last week, several meetings, someone from DC Health has repeatedly said, it would be far better for you to go to for you to call your own doctor. What's most important in terms of people staying healthy is that they have a primary care physician and a medical home, so that they have a physician who knows them, knows their health needs, and is helping them stay healthy right now. And address, you know, those underlying health issues that can cause someone to be at higher risk. So the best thing to do, if you have questions about testing, is to call your own primary care physician and speak with them about it. Because my expectation, anyone supported by DDS should have a primary care physician.
Do people who are at a higher risk for COVID need a doctor's note, or can they get tested straight away?
I think I just answered that, but so folks who can get tested at the public health sites don't need a doctor's note there, but the recommendation really is that you call your own doctor and coordinate through them. Just because they're going to address all your health needs and they're going to talk to you about staying healthy in all areas, not just about preventing COVID-19.
Can everybody take the antibody test?
So we've heard a lot lately about an antibody test. Do we have DC Health on the line? One has to be very cautious about antibody tests right now. I'm giving you what I've heard from LaQuandra Nesbitt, from Dr. Nesbitt from DC Health. People may have read recently that the FDA is now kind of cracking down on a number of different companies that have done antibody testing, because there were a number of different antibody tests that came out recently, and people have gone out and gotten them, and the accuracy of those tests have been a concern. There is antibody testing coming to the district very soon. I thought it was even by the end of this week, but we're at the end of the week and I haven't heard yet. We will be ending at 11 so that people can hear the mayor's press conference. Maybe there will be an update about it. But there is an FDA-approved antibody test that will be coming to the district. So people should be cautious in getting antibody testing to make sure that they're getting antibody testing that is accurate.
Has there been any thought about how DDS and the providers are going to reintegrate their people back into the community? For those who attend day programs, how will their staff work with them in terms of social distancing between each other? Where in the community where they will go, and at what point time frame will the disability community be exposed to the community?
Those are all very good questions. So as I said, the mayor has been working on, she's put together the advisory group on the Reopen DC advisory group. We have a small focus group conversation tomorrow afternoon or late tomorrow morning with some people to begin talking about some of these issues regarding what reopening looks like. We are beginning to have meetings between DDS leadership and provider agency leadership, and we'll be engaging with the people we support to begin talking about what does this look like, because I think this question of what will day services look like going forward is a very good question for a very long time. You know, we're going to need to ensure that people are able to maintain social distancing. You know, that suggests some challenges for programs that are facility-based, where people stay in a building all day, in terms of being able to engage in activities there in a safe manner. But it also presents challenges if the interest that people have has them going into the community. And so, you know, as we begin to talk now about things opening up, we need to start thinking about and talking about what do people's days look like. And, you know, it's interesting to me that I had heard one person say that these conditions kind of make them feel like being back at Forest Haven, where you're not allowed to go out, essentially, without permission. What's interesting about it is that's what we're all experiencing now. So it isn't people with disabilities who are being prevented from going out. It really is the whole city. And it should be the whole, well, most of the country. There are some areas where they've not been as affected, so there may not be community spread and it may be safer. But in DC right now, venturing out, getting on a bus, getting on the metro, all of those things present risks. All of those things present an opportunity for a person to come in contact, direct personal contact with another person who may have COVID and not even know it, and could transmit it. So we all have to be really careful at this time. And, you know, it's our hope is that by being careful in this way, we're going to see the numbers begin to come down in DC and slowly open things back up. And that's the issue, is that we need to talk about what does slowly opening things back up look like. And, you know, the mayor has the Reopen DC group that's looking at how we reopen, but when we reopen is all about the facts on the ground. It's about when we're at a place in the district where we see our numbers coming down and where it's safe. And what we need to do together now is be developing that same kind of plan for what is this going to look like, and the when will be decided by the facts in terms of the science of how safe it is to engage in particular activities.
Please provide a breakdown of the data information by residence type.
Oh, okay, I can do that. It'll take a minute, so if we could go on to another question, and then I'll give you your answer.
The next question is about our staff, provider staff fatalities on COVID-19.
Is that a question or a statement?
There were 4 staff reported last week, 3 reported this week.
Did you ask, or are we on?
Yeah.
So I'm sorry, yes. The report last week that there were 4 people was an error, and there have been 3 fatalities of provider staff. Okay, so by provider type, in terms of COVID-19 diagnoses, there were 66 people who were in supported living, 48 people in ICFs, or intermediate care facilities, 22 people in residential habilitation, RESHABs, 6 people who were in their own homes, 2 people in a host home, and 1 person who is in a nursing home. And the deaths by provider type have been 1 person in a host home, 2 people in their own home, 6 people in supported living, 1 person in a residential habilitation placement, and 11 people who in ICFs.
Is anything being done to create a crisis team focused on prevention of continued spread among those supported by DDS?
So, Winslow will address this and talk about the work that his team is doing to make sure that, you know, and part of what concerns me about talking about a crisis team is we've had we've had 250 people who have had potential exposures to this, and 145 who tested positive. So what we've tried to ensure is that our whole team is addressing this across all of our providers. And so Winslow's assigned his nurse consultants to work with each of the providers, and they also coordinate with our quality resource specialists and the service coordinators, but he can talk about how they all work together in this.
So the team, the health and wellness team, as well as the QRS staff, have conducted the following in hopes to prevent/mitigate the spread. They're providing telephonic, computer-based technical assistance on mitigation, that is, how to prevent the spread of the virus. This includes homes that do not have people who have had exposure to COVID or people who have tested positive. They also provide technical assistance to homes where people have tested positive and have been exposed to staff or other people who've tested positive. Daily, they're tracking these cases. We're tracking positive cases. We're tracking exposure, providing TA in both of those settings. And this tracking is being shared with DC Health on a daily basis. We have a physician consultant who has been involved when requested through our medically clinically complex process to actually be involved in hospitalized cases and or people who are being treated at home. Everyone who is hospitalized is followed by a nurse practitioner during their hospitalization through transition back to their residential setting, be it natural home or provider setting, at which point that particular post-hospitalization transition is then handed off to the assigned nurse consultant for the respective provider, and if it's a natural home, it's handed off to a nurse practitioner who follows natural homes. Daily, we've been in communication with DC Health, we being the health and wellness team and myself. We've been discussing the development of testing resources as they have been recommended and made available throughout the community, and sharing information on PPE requests from providers and tracking that with DC Health. And we've been tracking positive COVID cases, exposures, and that would be staff as well as people served. And in terms of mitigation, sharing the staff data with DC Health, who then has databases of other types of settings where people who do this in-home type work could possibly be working, ensuring that these people are not taking continuing to work after testing positive. As you heard the director say, many people who are testing positive are asymptomatic. Many of you on the phone may actually have a positive COVID test result without feeling a thing. And then we've also developed training on mitigation strategies that have been shared with the respective provider clinical teams, mainly nurses. And so when we talk about the idea of a crisis team, there is no current magic bullet for the coronavirus. So when we talk about a crisis team, that term, it sounds very, it sounds as though a crisis team would be able to solve this problem in real time. And what I'm telling you, we don't call our clinicians a crisis team. What I'm telling you is that there are people on the ground every day working in the provider community, to include primary care physicians, medical directors, and nurses who work for providers, that are actually mitigating this crisis. We are seeing that every day. So I don't know, like, if people want to call it a crisis team, we'll let you call it what it is. But every day people are working to mitigate this virus.
What is DDS doing to ensure that when a staff person who works with multiple providers tests positive for COVID, all of these providers are informed? How is DDS using the provider staff list it indicated it has compiled?
I do want to say, first of all, we get reports every day, or as we get reports each day of staff who test positive. We share those with DC Health. Because I see questions about, you know, are we reaching out to providers to tell them that someone who works for them has tested positive? No, we are not. We are not the public health agency, and so that aspect of it is not something we do. But I do want to let Kirk speak to what we do in terms of, because we have collected this information, so we are learning where, you know, if we get the report of a positive person, I don't know if we've gotten one yet, that we also know now that that person works at multiple sites.
So yes, Director, there has been exactly one that we've seen, one person who has worked at multiple sites. Every time we get a new staff name, we do compare that name to the list that we've compiled, and we do a thorough search. I do it myself, actually, to make sure that, you know, how many agencies they're working for. And if we do identify someone, we pass that on individually to DC Health, along with the list of everyone who tests positive staff-wise to DC Health as well. So we, you know, it's like a double check just to make sure, and then we pass the information on as well.
During last Friday's call, DDS reported that there were 47 placements under what DDS would consider quarantine. What is the number now?
I mean, I would have to look at that. I had come prepared last week with that number because I looked at all of the who is currently quarantined when I was looking at my list, and I didn't do the pivot to do that calculation today. I can be prepared in the future to report on that each week if people would like.
Across the country, including our neighbors in Maryland, DDA agencies are releasing social media campaigns, letters, memos, et cetera, showing support and appreciation for direct support professionals. We have yet to see this done in DC. Are there plans for this to happen in the future? Providers have done this themselves, but it would go a long way in terms of support and making people feel valued coming from DDS.
So I have tried to talk about this each week on our calls. The mayor, in her mayor's order that was issued that extended the public health emergency until May 15th, also recognized the contributions of all direct care staff. We'll be meeting next week, our leadership with the provider leadership, so I would like to hear more from them about steps we can take. As I've said, each week here, you know, here as well as in our provider meeting, how much I value the work that's being done by all the folks on the ground, the direct support professionals, and all the staff at our provider agencies who are really on the front line of this. So if there's more that we can do to communicate that, I'd certainly like to work with the providers to figure that out, because, you know, as we get very busy on our end of trying to support providers, I do want to make sure that we're also communicating as clearly as we can how much we value the work that they're doing.
All right, and we have a question in the text box asking, The types of services and supports from social workers and agencies in the disability communities need to change completely post-corona. To which organization should I send a strategic proposal beyond core service agencies, including Mary Center? Should I send the proposal to the mayor's office or Office of Disability Rights? Can we create a new platform to integrate ideas and insights from patients and peers in the disability community into policies and practices?
So this is exactly what the mayor's Reopen DC advisory group is all about. If you will go to coronavirus.dc.gov, there's a tab at the top that's called Reopen DC, and in there, it's got share your ideas. And the mayor is looking for people to share their ideas about how to make DC even more inclusive and equitable for everyone after we emerge from this public health emergency. And so please go there. There's also a phone number where you can call and share your ideas if you don't have access to the internet. And that number is 202-442-4755.
We are so far from having community spread under control among people supported by DDS. This still is a crisis.
No one's questioning that. I think, Carol, you know, I don't want to get hung up on words here. This is how we're living every single day. And so when people say you're going to have a crisis team, I get the idea of someone who goes out and fixes it. Well, this is actually our new way of life, where we have 10 nurses who spend each and every day working with the providers assigned to them, making sure that they have the information they need in each of their locations to ensure the safety of people, whether it is that someone has tested positive or periodically reaching out to those where fortunately they've had none to date. I don't disagree that we are, I mean, partly we're at the beginning of this because in order to move into, you know, a further phase of this and safety, we have to be at a place where there's a vaccine and some reliable treatment. And that's going to be quite some time. So, you know, we are actually seeing some better numbers. We're seeing some more success by providers. And so, you know, I don't want to suggest anything about what that means at this point in time, but no one is trying to downplay how serious this is. We're just relaying to you how we have put what we believe is a very strong structure in place to deal every day with the public health emergency that we're all dealing with.
And, you know, I'd like to just add that if you have ideas of what you think we should be doing that we're not, please send them to me at winslow.woodland@dc.gov.
How fast do we get the results after being tested?
That depends on who does the testing. So you would have to ask that at the location where you get the testing done.
Equity and Vulnerable Populations Committee needs to continue after Reopen DC disbands with representation from people with disabilities.
I'll just repeat, please go to the website, enter your ideas. My understanding as of my last meeting on Wednesday was they've gotten over 10,000 ideas, but please do enter ideas of this nature to the website coronavirus.dc.gov under the Reopen DC tab.
During last Friday's call, Winslow reported that there were at least one provider who had successfully used the process that DDS is coordinating with providers and the DC Public Lab to get appropriate people supported by DDS to be tested, and that DDS has developed guidance on instructions about how testing specimens should be obtained, how the chain of custody should be handled, and how to arrange for a carrier pickup to go to the DC Public Health Lab. How many providers have used the process since then?
As of this week, we have had 3 providers who have used the process, and the first provider to use it has used it a second time. It's one of our larger providers. And to date, we have 20 people from last week who have been tested and whose results are either have been returned and or in process. What we also have learned this week is that several of our providers have, within their own resource cadre, have developed testing procedures to include those who are using their actual primary care physician to obtain specimens and working with labs. We also have providers who have used community-based testing sites for people who that's more appropriate. And I'd just like to add that with regard to testing, you know, it's come to my attention that people have mentioned that there are multiple free testing sites and they're throughout the community. You heard the director mention several of those. I just want to just share with you that the complexity of some of the coordination around that and putting people at risk by transferring them outside of their home to larger facilities and exposing them to others is the reason why we're working feverishly to ensure that in-home testing is available to those that would limit their risk of exposure. We're working on this every day to ramp it up as quickly as possible.
There's a comment asking about compiling the list of questions from past and present. And so just wanted to remind everyone that our forums are recorded and posted to our website at DDS. And we also have transcripts available for you to access that as well. Can you confirm DDS is performing contact tracing in all settings?
So let me just be clear. Contact tracing is a very specific public health epidemiology function. Are we doing that? No, we are not. The district, DC Health, is currently actually, and you'll see on DCHR's website, hiring a number of people who will be doing contact tracing. Are we tracking and monitoring all reports of contacts with someone who has tested positive? Yes. But we are not the public health agency, and I wouldn't want to pretend to be, you know, doing a function that really is the DC Health epidemiology function.
What does DC Health do when they know staff who have tested positive work for multiple providers? Do they contact each provider to report that they are positive? If not, why not?
My understanding is that what they do is that they reach out to the person, talk to that person about what that person needs to do to ensure their safety and the safety of the community. The district has engaged in quite an extensive effort to ensure that people who test positive are able to stay home, that they get all the resources they need. I think, I don't know about every agency, all the agencies in the Health and Human Services cluster have detailed staff who work on this project to reach out to people who've tested positive, to check in, to make sure that they have the resources they need to not leave their home. And if you think about the work that the health department does in any other reportable disease, They do not go out disclosing people's health status to other people. They do have some level of police authority if they feel that a person causes a risk to the community, but they certainly don't start with disclosing people's health information. They do reach out to the person. And my understanding from speaking with the person at DC Health who is responsible for this, they have not really had issues with people adhering to the guidance that they get about how to ensure their own health and the community safety.
When public buildings have infected residents, like the Wallach House, would it be made known to the public to warn them? How do they keep the building clean and sanitized?
So, I have heard of buildings where people get a notice that a person in your building has tested positive and that the building has taken the following steps to clean all public areas. Keep in mind, we've talked several times today about people who are asymptomatic and positive. The fact that whether the building knows that someone has tested positive and makes people aware, what we should all be very aware of is if we're going through a lobby, have we touched the button on the elevator with our hand, or can we touch it with something else? Are we careful to use something other than our hands when it's possible to open doors? If we do touch these things, are we careful not to then touch our face? Do we wash our hands as soon as we arrive home? I know I keep hand sanitizer in my car for as soon as I leave the grocery store to clean my hands. So being aware ourselves of the steps that we can take, because we should assume that someone with COVID walked through the lobby before we did and touched everything. And so, act as though that occurred and be careful in that manner.
All right, so we have one last question. I would like to know how the DSPs or aides are being tested to make sure they are not infected, especially when they leave to go to their home and come back to work in the homes with people and the elderly.
So that question in the question pointed to the difficulty of the answer, which is testing a DSP has very limited effectiveness in protecting people. Because if you test a person today, all that you know is that if they tested positive, they tested positive and they shouldn't work with anyone today. If they tested negative, they may still have had an exposure to COVID-19, and tomorrow they may test positive and be contagious. So, we all learned this week from the White House, where they test people every single week, and yet they had a staff person who had been working there who then tested positive. And so, testing people, I think it leads us to feel like it's some level of protection, but in many respects, it really isn't. I mean, like I say, if someone tests positive, we know that today they need to go home. But if they test negative, we know very little. All we know is that today they don't test positive. And it doesn't mean that they were not exposed right before they walked into the house. It doesn't mean that they didn't just touch something that they're now going to touch you. And so that is why it is essential that we're all aware of the steps that we can take, the sort of good hygiene steps of making sure. When the mayor put out her order regarding the different placements for people who are considered at higher risk, it spoke to the necessity when people arrive at work that they wash their hands as soon as they arrive with soap and water, that they use face covering while they're there, that they, to the extent it's possible, maintain social distance. So, you know, we all need to make sure that we're taking these steps. I understand the concern about it's the belief that having people tested will give us some security, but, you know, in some respects, having people tested could give a false sense of security, and it could cause someone to believe that they don't present any risk, and then they might not be as careful to take all the necessary steps to ensure that they're being safe around other people. If they took a test today and it says negative, we see our own president walk around and say, I got a test today, I know I don't need to wear a mask. We don't want people having that attitude. We want people to continue to ensure that they're taking all the steps necessary to ensure their own safety and everyone else's.
How do people report violations of garbage disposal violations of PPE?
I don't know that there are any. PPE is not something that's considered biological hazard that needs to be disposed of in a particular way. I don't believe, but like, you know, we're DDS, I'm not the health department.
DRDC has suggested greater specificity with respect to crisis team. I hope you're taking their suggestions on board.
We have received them and we are considering them, thanks. Oh, next week. What? So are we on? So next week, we will be having one big forum. Our people may be aware, the mayor's budget is supposed to be released on May the 12th. Our budget hearing will be on 2 dates. Public testimony will be provided on May the 22nd, and the executive testimony will be on May the 26th. We will have a budget forum. So we're going to have just one call next week for everyone, and it will be?
May 15th from 12 to 2.
It will be a 2-hour session from 12 to 2 next week, and we will walk through the DDS budget at that time with people. So someone asked if the city council building is open for people to give testimony. No, it is not. All testimony will be given remotely. People can sign up to give testimony. I'm not sure where the instructions are for that.
I would keep checking the DC Council's website for further information. Just bring up the actual site.
And we'll have instructions for people on how to do testimony when we have our budget forum next week.
And so you'll receive invitations for our budget forum between today and Monday with the access information for WebEx and the telephone number.
Okay. Thanks to everyone who's been able to join us, and we will talk to you next week at noon.